If your doctor is telling you your back pain is coming from a weak core, run. What's up guys, Dr. Joe Roskowski here from IDPT, and today we're going to be debunking the myth that back pain comes from a weak core. What we're going to be doing in this video today is explaining exactly why I don't believe this to be true, but then we're going to talk about what I do believe to be true, a test that we can use to prove it, and then potentially a solution for after the fact to get you moving in the right direction. So what I want to do is explain normal human movement and then explain where I believe certain factors go wrong, certain mechanics go wrong, leading to back pain. So what I want to do is start with a human as a blank slate. What we know to be true is that to put any force into the ground, whether that be walking or just standing still, pushing into the ground, we need internal rotation throughout our entire body, specifically hip internal rotation. If we cannot get that hip internal rotation, the number one compensation is for the pelvis to dump forward and for the spine to arch. If that happens, we get a big arch in our lower back, and you can see that arch in the lower back is actually going to push your lower stomach and your pelvis forward. This is going to result in your low back muscles and your spine compressing down, which gives you that feeling of that constant tightness in your back. And from a fundamental level, the idea that having back pain is from a weak core really doesn't make sense if you think about it. Who do we work with here at IDPT? We work with athletes and people who are in the gym really frequently, 5-6 times a week, and they're strong people. So how is it that they can squat and bench and do all these things so heavy, but yet their core is just weak? There must be more of a mechanical reason or a better understanding of why this is happening. So what I want to do is show you a test that you can do on yourself that can prove to you whether your back pain is coming from this pelvis position or not. And what this test is going to be is testing your hip external rotation. Now I know what you might be thinking is I said missing internal rotation is causing this issue, which is true. But when we're missing internal rotation, the pelvis goes forward, what happens is we block the front of the hip socket. When the front of the hip socket is blocked, the hip now can't turn out, which is why that's the exact motion we're going to be testing. Here's how we're going to test hip external rotation in each leg. So what you're going to do is lay on your back with your leg straight. You're going to bring one knee to 90 degrees. And then what you're going to do is try to turn your knee out and your foot towards you. So what we're doing is actually turning the hip out. Even though your foot's coming in and it may feel like you're turning in, you're actually turning out from your hip. And then once you feel any natural resistance or any tightness, stretch, any sensation at all, that's where you're going to know to stop the test. What the goal is to get to about 60 degrees, which for me would be a little bit further this way, okay? And if you feel any pinch in the front of your hip, what that is your hip getting pinched up from that socket getting closed off. So then you can go ahead and switch legs and test the external rotation again. Now, if either hip is limited, then you know that to some degree your pelvis has gone forward and your back is arched. All right, so if you did this test and you had less than 60 degrees of external rotation in your hip, here's one exercise that you can do right now that's going to start moving you in the right direction and giving you back pain relief immediately. So what you're going to do is you're going to lie on the ground with your knees bent and you're going to elevate your feet about 2 inches. I used boxes here, but if you're at the gym, you can use plates. You can use like the first step in your house, or even you can stack up books not too high. So what you're going to do is you're going to make sure you feel the inside of your heel and the inside ball of your foot on the ground on both feet. The other thing that I want you to feel are these 2 circle bones in your lower back on the ground. You're going to roll your hips underneath you a little bit so that your back goes flat. Slightly press your heels down to feel your hamstrings turn on. And then from here, you can put your hand on your chest and breathe into your hand. I want you to breathe in through your nose and take a full breath out through your mouth. Do this for 3 sets of 10 breaths and then recheck your hip external rotation. Now what happens if you did this hip test and you actually had 60 degrees or more and you didn't have any restriction in your hip? Well, what that means is that you're missing internal rotation, but your body did not compensate and throw your pelvis and your spine forward. So if that's you, you would likely benefit from some type of individualized, specialized, in-person work. But also what we're gonna do is put together another video for someone like you. So make sure you go to that video for that. So the next time someone tells you to strengthen your core to get rid of your back pain, remember that body position and posture comes first. So we need to bring our pelvis back underneath us and get the rib cage and the pelvis aligned. When this happens, then we can start worrying about strengthening our body. If you want more videos like this, don't forget to subscribe, follow, like, and comment any questions that you have. And if you want more individualized tips, feel free to shoot us a message on YouTube, Instagram, or TikTok, and we'll be happy to respond. Thanks, guys. See you at the next episode.